Sit tight for just a minute or two. Welcome everyone to today's forum, Portland's Behavioral Health Crisis, Seeking Solutions. We'll give it a couple minutes to allow everyone to get settled, and then we will begin. Thank you, Commissioner Myron. Looks like we've got our team here, so we are good to go. We'll give it just a minute more, and then we'll begin. All right, good afternoon, everybody. It's 3:03, and we've got a long program before us and a very important one as well. Good afternoon, everyone, and thank you for joining us today for the forum, Portland's Behavioral Health Crisis, Seeking Solutions. Based on the more than 555 registered, we know that you are seeking solutions and answers too. My name is Keith Wilson, and I am the chair of Shelter Portland and CEO of Titan Freight Systems, and I'll be your moderator during the question and answer segment of this forum. Our sponsor for today's forum are Neighbors West Northwest, Downtown Neighborhood Association, Pearl District Neighborhood Association, Old Town Community Association, Goose Hollow Foothills League, Northwest District Association, Southwest Hills Residential League, and the Revitalize Portland Coalition. It is our great pleasure and honor to welcome and thank our panelists for joining: the City of Portland Mayor Ted Wheeler, Multnomah County Commissioner Dr. Sharon Myron, Oregon Metro President Lynn Peterson, Oregon State Representative Dr. Maxine Dexter, Oregon Senate Majority Leader Kate Lieber, and Oregon Health and Science University School of Medicine Carruthers Professor and Chair of Psychiatry Dr. George A. Keepers. Thank you all. Thank you to Neighbors West Northwest for also producing today's program. Well done, Carl. Extremely well done, especially with all the efforts this past week. A special thanks to Darlene Garrett, Stan Pinkin, Richard Perkins, David Dixon, Eric Cole, and the dozens of others community volunteers for their leadership in bringing this forum to life. And finally, thanks to the staff of the members of the panelists for their outstanding help over this last several months. The forum will consist of two halves. The first half will be focused on our panelists providing their perspectives on behavioral health and what can be done to address the crisis playing out in our community today. The second half will be a question and answer segment with our panelists answering questions received from the members of our sponsors. We are going to dispense with introductions and ask that our panelists provide their official capacity and the role they play in the community with regard to behavioral health. Now, representing our sponsors, I'd like to introduce you to Stan Pinkin, President of the Pearl District Neighborhood Association and Chair of HomeShare Oregon, to welcome our panelists and set the stage and the goals for today's forum. The floor is yours, Stan.
Thank you, Keith. Good afternoon, everyone, and thank you for being here. I am honored to open this forum on behalf of our co-hosts mentioned by Keith. Today, we will be talking about finding true and meaningful solutions to the behavioral health crisis that is plaguing our city and our state. We see it on our streets every day, and by many accounts, it is getting worse. It is well known that Oregon ranks at the bottom of all states in providing behavioral health care. This is unacceptable and must be fixed if we are to be a healthy, livable, vibrant, and viable community for everyone. Before we get to our panelist discussion, I want to introduce Christy McMurtry, who has a personal story to tell about our behavioral health crisis that has affected her and her family and our entire community. Christy, thank you for being here to tell your story.
Absolutely. Thank you, Stan. And thanks to all of you for coming together to fully lean into this humanitarian and moral crisis. I am speaking from my downtown church at St. Stephen's, which is also home to Operation Night Watch, and is a group that provides hospitality and dignity to those like our son. Our family has 17 years of lived experience in a system that has been failing for decades, and I have also been doing advocacy for those 17 years. Our son, Kenny, died just 11 days ago in Ashland, Oregon, from an overdose, 2 days shy of his 34th birthday. But Kenny's journey to his final day really began about 18 years ago when he had what was known as early onset of psychosis. His pediatrician referred him to a top psychiatrist who explained he had a chronic brain disorder, but his quality of life could be quite good because it was caught early. Catching and treating are two different things, especially when part of the disorder is lacking insight into their condition. The term for this condition is anosognosia. Sadly, it is quite common. His psychosis escalated, and in 2009, we had to call 911 for a crisis team to respond. Again, against his will, he was handcuffed, taken in the back of a patrol car up to OHSU psych ward. This was horrible and traumatic. He was there for 10 days, barely enough time to put out a fire in his brain. But this was also not a healing or holistic setting for a 19-year-old. What were the step down options? None. Back to his home. Fortunately, a person from Multnomah County's Early Assessment Support Alliance, known as ESA, came to us in the hospital and said he could be in a 2-year wraparound program. He agreed. He was still in our home, but we had a team to support him and us. ESA is a proven, cost-effective program, but despite Kenny's healing and great progress, the program was designed and funded just to provide 2 years of support. How stupid to waste that investment by not having something next to offer. So this was the first crack he fell through, and probably the worst. He had independent housing for a few jobs, but it never worked for him. Housing and rent assistance without support doesn't work for so many. He began self-medicating with cannabis, something that amplifies psychosis and dulled the pain of his life. 3.5 years ago, he got assigned to Portland Police Bureau's Behavioral Health Unit. During one episode, they placed him on a hold and took him up to OHSU. The first time in 11 years, he's finally in a hospital where we naively think he might be helped. He was released to the streets the next morning with a diagnosis of agitation. Another crack. His primary care doctor was with OHSU. He has records there. He's on disability because he has a disability, and his rights trumped all of that. So we don't know why we don't have a database like Built for Zero that would connect these dots and help stop this revolving door. After this, we lost his trust. His paranoia escalates. We couldn't feel safe in our home. He took off and was homeless for the last 3+ years in 3 different states. He was jailed for trespassing in Jackson County. He called for help. We tried to advocate again for him to get treatment. He was released to the street. Again, another crack. When we encounter someone who's obviously not functioning at a level that we would never want to find ourselves in, we have to have places where people can be taken and gently handed off for de-escalation and or detox in a compassionate and caring way. I am a supporter of exploring the Crown Plaza as being such a place as that. We need changes to our civil commitment laws. We need to respect families by loosening the shackles of HIPAA and by listening to us, because we pay our taxes, we care the most, and we know all the cracks. We need to fund early intervention, education, and programs, because there are these young people out there and their families today who are on the same course. And if are not treated early, there will be more kids on our streets and more overdoses and more lost precious lives. We have the research, the expertise, and the money to fix this. And the question really is, do we have the heart? And speaking of hearts, I want to share one little thing. On his other wrist, Kenny had a bracelet, and there was a charm with a heart, and on it, it says, "Mom, thank you for listening to our story. Thank you for doing the work."
Christy, thank you for sharing that story. All of our thoughts are with you today. To achieve positive results and hopefully not have to hear more stories like that, We need all levels of government working together with local communities all across our state. To that end, we are pleased to have a conversation with our panelists joining us today, as Keith has already mentioned. To help set the framework for this urgent discussion, we are happy to have with us Dr. George Keepers, who will kick off the conversation and have 5 minutes. We will then hear from our other panelists, who, again, Keith has already mentioned. Senator Wyden, who we had hoped would be here today, sends his regrets as there is urgent business he is attending to in Washington. But I'm happy to read a message from him. As a Portlander, I share your frustration with the behavioral health crisis in plain sight on our city streets and in our parks, neighborhoods, and small businesses. But this crisis isn't unique to Portland, with behavioral health challenges evident in cities and towns across Oregon. The magnitude of the challenge is largest in Portland. And in fact, whenever I am in Oregon, I am asked what can be done to meet this huge challenge in Portland, because Oregonians know Portland's well-being is essential for the state's well-being. My answer to those Oregonians and to all of you today is that I'm working to move all the levers of the federal government to provide local officials with what's needed to design solutions that work best at the local level. I've pressed successfully for emergency rental assistance to keep a roof over Portlanders' heads. Similarly, I work to secure new permanent housing vouchers, as well as expand the number of housing choice vouchers so people aren't waiting years on end to get into housing. I'm forcing the federal government to crack down on the fentanyl pouring in from other countries. And I've got legislation that would expand low-income housing credits. But it wouldn't be on the level to say any of this is going to be easy, or that there's somehow one silver bullet to solve this crisis. That's why I'm glad all of you are coming together today, tapping into the collective wisdom of Portland's neighborhoods to design community-driven solutions. It's been my experience that the best answers don't often start at the top. They much more often develop at the ground level. And I very much look forward to seeing what develops from this grassroots forum and what part the federal government can keep playing to support your work. Thank you, Senator Wyden. Also in attendance today, we have some staffers from Senator Wyden's office. We have Grace Stratton. From Congresswoman Bonamici's office, we have Al Bannon. And from Representative Blumenauer's office, we have Jason Little. We have a commitment from all three of those officers to work with us on this urgent issue. Each panelist will present their thoughts on the following. 1, what part of the behavioral health system they are responsible for. 2, how they perceive the behavioral health system is working or not working. 3, how can it be fixed? 4, barriers to fixing it. 5, timeline for change. We are seeking very specific ideas on how different branches of government working with local communities can work together to find solutions. It is our goal that today's forum is not just another talk session where everyone leaves and nothing changes. Rather, we want everyone in this room to leave with a better understanding of this crisis and our leaders at all levels of government taking substantive action. It is our plan to follow up with the panelists after today to check on what progress is being made towards solutions. We will hold our panelists to 3 minutes with a heads up at 30 seconds remaining to wrap up their comments. These presentations will be followed by a Q&A session moderated by Keith Wilson. We have received numerous questions from the public and have done our best to consolidate them, and will try to get as many as we can within our time frame. We apologize in advance for not being able to ask your questions in the Zoom Q&A, which you will find at the bottom of your screen, but we will pass them on to our panelists for follow-up. Dr. Keepers, it's now my honor to turn the floor over to you, and thank you again for being here.
Thank you very much, Stan. Christy, I am very moved by your story and very sorry for your loss. I agree completely with the suggestions you've made that are needed to fix our system. I'm going to share some slides that will make the major points from my talk. Can everybody see these slides at this point? Yes. Current situation in Portland with a large mentally ill homeless population in the city's downtown, public use of opiates, methamphetamine and other drugs, unacceptable public behavior that's sometimes dangerous, has its genesis in a number of factors that I'm going to discuss today. First, Oregon's public mental health system and acute care system are underbedded, not supported by adequate step-down levels of care, and not coordinated by adequate information systems. Additionally, the capacities of certain components of the public mental health system are deficient, and that impedes hospitals' ability to discharge patients. Mental health and substance abuse treatment programs have developed in an uncoordinated fashion with no system-wide capacity for addressing unmet needs or facilitating the referral of patients between levels of care. In Oregon, we used to have enough chairs. The situation now is more like the lower picture. Second, in Oregon, mental health policies and programs are created by multiple levels of government and, of course, coordinated care organizations, and they're influenced by multiple agencies. Because of this distributed model of governance and the diffusion of responsibility that it creates, coordinated plans to address mental health and substance use disorders have been difficult to develop and implement. And as a result, as you've heard, Oregon ranks near the bottom, actually 46 out of 51, on measures of effective mental health care, despite the fact that we spend more per capita than most states. Socioeconomic conditions in Oregon have contributed to the crisis for our unhoused citizens. Oregon ranks 41st in overall affordability, and much of that cost is driven by housing affordability. Shortages of affordable housing, the slow response in providing temporary housing for the houseless are major factors in the visibility of mental health and substance use emergency situations. Fourth, a series of judicial orders, which began with the Oregon Advocacy Center versus Mink in 2002, have prioritized the admission to state psychiatric hospital of patients from jails and prisons for the purpose of restoring their ability to aid and assist in the defense of legal charges. The state hospitals, which were originally designed to provide optimal treatment for civilly committed patients, are now almost entirely forensic facilities, and they treat only the criminally charged or convicted. Admission of civilly committed patients is now a rarity, and as a result, civilly committed patients are being treated in acute psychiatric inpatient hospitals, general hospitals, and even emergency rooms for several days at a time. These are far from ideal treatment circumstances. Now, many individuals with substance use disorders are not competent to consent or to refuse treatment for their addiction. This is particularly the case for users of fentanyl, methamphetamine, and cocaine. 35 states allow involuntary treatment for victims of substance abuse through a civil commitment process. Oregon does not. Prior to Measure 110, arrest and judicial order were a pathway for mandating treatment for these individuals, albeit that was far from ideal. But without a revision of current Oregon law, no mechanism exists for treating people who are hopelessly addicted to these substances. And of course, sixth, there's been a dramatic increase in the use of opiates since fentanyl became widely available illicitly in the United States. Fentanyl is particularly lethal and generates a dramatic increase in drug overdoses and deaths, which we've certainly seen in Portland. In fact, the increase in Oregon has been higher than the national increase in drug overdoses.
Dr. Keepers, about 30 seconds left. Thank you.
Thank you. And finally, the mental health workforce in Oregon is insufficient to meet the need. It's aging and is primarily engaged in private rather than public practice. To meet the current and future demand for services will require substantially more personnel. The most urgent needs are for psychiatrists, social workers, nurses, and school counselors. And really, finally, this terrible situation is particularly tragic in light of the fact that the medical knowledge about how to treat serious psychiatric disorder and substance dependence is well established. Thank you. Stan, you're muted.
Yes. Always that famous unmute. Dr. Keepers, thank you. Thank you for that presentation, which I think describes a lot of the issues ahead of us. So I will now turn to our panelists and ask Mayor Ted Wheeler to begin. Mayor, you have 3 minutes and you'll get a beep at with 30 seconds remaining. So please, you have the floor.
All right, good. I'll do my level best to give bullet points here on an issue that is extremely complex. First of all, Christy, I have to take time to acknowledge you and your loss. Your story is why we are all here. So thank you for having the courage to share it. With regard to the mental health system, I think it's critical that we first diagnose the problem. We do not agree collectively on what the problem is. I would argue we do not have a mental health system in the state of Oregon. That's not to say there aren't many institutions, organizations, and individuals working really hard, but a system requires everybody to understand who is responsible for what, how things get done, and how we're going to pay for it all, how it's funded. And we currently don't have that. Moreover, I would say there are few people who have the bigger picture. There are probably even fewer elected officials who actually understand how the behavioral health system is organized. Federal streams of funding dictate the way states organize. States, in turn, through their legislatures, are responsible for the allocations of funding. That includes identifying how Medicaid reimbursements can be used. Those dollars then flow to county government in the state of Oregon. They are the health authority and the behavioral health experts at the local level. They have the personnel, the expertise, the streams of funding to be able to address behavioral health issues. But of course, all of these problems, the lack of a system, which I believe has been more or less intentional over the course of the last 40 years, the problems manifest themselves on the street. So it's very easy to say, well, it's at the street level, therefore people responsible for the street should be responsible for the system. And to the degree that we're able to, we can. We have a very limited role in the city of Portland around behavioral health or around substance use disorder. We're responsible for public safety, infrastructure, right-of-way management, and the like. We don't get dollars, we don't have the expertise, we don't have the professionals, and we don't have the streams of funding to address this. That being said, we have reinvented government to address the problems we're seeing on the street. Later on today, I'll talk about our task sites. We can talk about Portland Street Response. We can talk about the Behavioral Health Unit, the Police Bureau, CHAT, and the Fire Bureau. But the bottom line is, as long as we keep missing the reality that there are upstream obligations around planning, around determining who is responsible for what and funding it all, we're going to continue to have these conversations. I see an opportunity here with the governor convening a task force around downtown Portland, the central city. And I hope what comes out of it is a 5-year plan, a 7-year plan, and a 10-year plan to actually put into place mental health infrastructure in the state of Oregon, including who does what, who's responsible for what, how, and how it gets funded. And I will support the governor in those efforts if that's where the task force chooses to go.
Thank you, Mayor. I will now call upon Multnomah County Commissioner, Dr. Sharon Meyer.
Unmute many ways. So I too want to thank you, Christy, for sharing Kenny's story with us, and my heart continues to go out to you. Thank you to Dr. Keepers. I've been honored to work with you as a physician colleague, and I agree with everything you said from the healthcare standpoint. Mayor Wheeler, you were spot on in all that you said about the political systems and discoordination that contributes to what we are seeing on our streets. And I appreciate that virtually all levels of government touching these problems every day are here represented. I look forward to working on these solutions together. But we do not need to coordinate Metro or have our federal delegation work on solving the American health system in order to make Portland as safe and livable as we all deserve it to be. I'd like to point out one indisputable fact, and the mayor touched on it actually, and that's that the government most responsible for the safety net in Multnomah County and for behavioral health is the government that is currently failing us most. It's my own government. It's the county, the local mental health authority. If we had a plan at the county, we have more than enough money to make an incredible difference, improve public health and safety, and save people's lives. We are not short of money at the county. Don't let anyone tell you that's the case. We are short of leadership and accountability and a plan. I regularly hear from providers, they don't know who to call at the county for behavioral health expertise. And we're the local mental health authority. When the governor or her team need to talk to someone, I don't know who they call, aside from the chair, who turns around and says that we don't have enough money or partnership from state and federal partners. But we do. I worry one of the other government entities here today will need to step in, because without leadership and accountability at the county, we do not have the capacity to do our job right now. And that is really scary to me as a healthcare provider and an elected official. The broader level in the state, I just concur with everything that's been said. People working in and using the systems have been doing workarounds and crying for help and dying for decades. Elected officials with the power to fix the systems many of them don't understand that. They respond to the crises and they fix things by spending money, but they're uncoordinated fixes. And so things keep getting worse, and then elected officials wonder why. Spend more money. We need to bridge the disconnect. This forum is a great first step. I look forward to discussing solutions, including civil commitment statute changes, sobering centers, and recovery-based transitional housing. Thank you.
Thank you, Commissioner Myron. I will now call upon Metro President Wynn Peterson.
Good afternoon, everyone. I also want to thank Christy for sharing her story. I believe that these stories are important to share because we are working on collecting more data. People are not numbers; they are souls, and we are entrusted to make sure that every single one of those souls are safe. And I look forward to working with my colleagues and everybody here on making sure that's the case. I'm here as Metro to really talk about our role in all of this. And you all know that we have a new program. We're 24 months in, and it is really reliant on the 3 counties in implementation. We passed the funding measure in May of 2020 called the Supportive Housing Service Measure. And that program began about a year later after the plans were created by the 3 counties. The Supportive Housing Service Measure was designed to focus on 2 populations: people experiencing homelessness with disabilities and people at high risk of homelessness, by providing the types of housing and services people need to stabilize and end their homelessness. This can include things like financial literacy, employment services, and it absolutely includes behavioral health services. In fact, Multnomah County used the SHS dollars to open up the county's first ever behavioral health shelter on 82nd Avenue called Cultivating Community, run by New Narrative with a full continuum of mental health services on site. But it is not a secure residential treatment facility, and SHS is not a behavioral health initiative. It is a homeless service initiative, which is a critical distinction. It means that we need to be working together to ensure our region has the resources it needs for all of the services that our residents need. So Metro, with the support of the voters, has stood up to ensure that the critical resources for homeless services are available through the 3 counties, and that this is a critical piece of the puzzle in addressing the behavioral health crisis. But it's certainly not the whole picture. Sufficient federal and state funds directed specifically for behavioral health must materialize as well. Thank you.
Thank you, President Peterson. And now I call upon Oregon State Representative, Dr. Maxine Dexter.
Thank you, Stan, and thank you, everyone. I am really honored to represent downtown Northwest Portland, Linton, and Cathedral Park, areas that we are very well represented by today, and thank you for hosting us. I'm honored to be here as in my role as chair of the House Housing and Homelessness Committee, as well as a member of the Behavioral Health and Healthcare Committee. Those are the roles that I have impact on the system and the issue. I also have personally been caring for people enduring the deep harms of addiction and substance use, the impacts on them, families like the McMurdays, Kenny, taking care of people who have overdosed in the intensive care unit as a physician. And as a mother of teenagers, I feel this very imminently. It is no longer safe to experiment with substances. It's deadly in way too many cases, and we need to really urgently address the health and safety of our communities, which is why we're here. We are doing some things really well. We're coming together, we're identifying the issues, we're trying to elevate importantly impactful ideas. And I will just acknowledge that what Christy said, she offered a lot of those, de-escalation and detox, compassionate and coordinated responses to people in need, and sustaining that response, not investing and then walking away. We need a system that addresses people as people, and communities that we invest in will be more resilient. I will take the position that's really complementary to my roles, that food and shelter are foundational, that if we do not provide the most basic needs to people, that we cannot address their mental health issues or their addiction issues. Addiction is a disease, and it's a disease of despair. And people who have lost hope, who are in constant crisis and feeling traumatized by their inability to provide for themselves and their families, turn to substances to help alleviate that pain, whether it's anxiety or distinct pain. We have to acknowledge that food and shelter is not being equitably and sustainably provided in whatever means to our communities. And if we focus on that, I believe that many of our issues will over time dissipate. And it is because we have failed to invest in those systems for decades that we are in the situation that we are in right now. It could go on for a long time, but I just want to say that this is an urgent need, and good change takes time. And we are elevating important and impactful policies. And it is human nature to be unsatisfied and want to try something different. And I just want us to be careful that we continue to invest in the things that are working and not be afraid to acknowledge where they're not, and iterate and continue to focus in a sustained way together. Thank you so much.
Thank you. And now Oregon State Majority Leader, Senate Majority Leader, Kate Weber.
Well, thank you so much for having me. And I really appreciate this conversation. You know, when I got elected 3 years ago, I was very interested in the intersection of mental health and the criminal justice system. Being a former prosecutor, I also spent 8 years on the Psychiatric Security Review Board. So I understand what's happening at the state hospital, and I couldn't concur more with Christy's conversation around what we need to be doing in that system. So The legislature, we're funders. That's at our core. We are funders at the state. And in the last 3 years, we have invested enormous amounts of money, over $1 billion into this system. But I cannot agree more with the mayor that this system is uncoordinated and we do not have the system that is pulling it together. So we also know that what happened in the middle of all of this was we had a global pandemic that took the cracks in the system and just blew them apart. We had a homeless situation that during the pandemic got increasingly worse. And our fentanyl and meth problem has continued to just bloom and blossom. And it is the thing that we have to concentrate on the most. So as I see it from the state perspective is we have to continue in sort of 3 areas. One is we have to make sure that we are investing in education and prevention. We can no longer, exactly as Representative Dexter said, we can no longer allow experimentation. It can be deadly. So we have to invest in there. We also have a public health response, and that public health response needs to have additional accountability within it. And we have to have a system that we all agree on. What we have right now is a fragmented system that doesn't have the steps in it that we need. We need to do an analysis, get on the same page, figure out where our gaps are, and then figure out who's filling it and who's funding it. I remember when I first got into the legislature in 21, I was so surprised at how siloed all of our funding is. We have to braid that funding together in order to have a system where we treat both mental health and addiction. And then a third piece is we have to have a criminal justice response. It is unacceptable what's happening in the city of Portland. We cannot have an open air drug market. And we have to make sure that the police, the prosecution, and the criminal justice system have the tools that it needs to address it. But this system has to be coordinated. And we have to figure out how we continue to work on that coordination. The other thing I would say, as I've said all along, and I know Commissioner Myron is sick of me saying it, is we have a 3-legged stool that we have to invest in, and you have to invest in it equally. You have to invest in housing, you have to invest in the mental health system, and you have to invest in the substance use system. And you have to invest in all 3 of those, because if one of those fails, the investments in the others don't actually make sense. So as we continue to talk about this and talk about coordination, these kinds of forums that you're having here are really incredibly important. And I just want to thank you for having it.
Thank you, Senator, and thanks to all the panelists for all your thoughtful comments and ideas. And also, thank you for sticking to the time frame. I know that is really, really difficult. So we appreciate that. We know there are so many questions to get to. And as I said earlier, we can't get to all the questions from our attendees, but I am going to turn it over now to Keith Wilson, who is going to start the Q&A session of this forum. Keith, take it away.
Thank you, Stan, and thank you, panelists, for that presentation and your points. During this half of the forum, I will be guiding our panel through a list of questions received from our community. The Forum Question Committee compiled them into key themes and edited them for context. Many of the questions noted the feeling of frustration and compassion fatigue. Community members literally said they were sick and tired of feeling sick and tired. Here's an example. Quote, I live downtown and witness what's happening on a daily basis. People walking around partially clothed with needles in their arm, particularly in the block between Nordstrom's and Target, but too many other places as well. Businesses that haven't closed yet are talking about closing. The city center is becoming a slum. I've attended meetings like this before. They have not resulted in my neighborhood becoming safer or the Portland I love coming back. I don't think the city has the will to make tough choices. One quote was, we are becoming numb. Another said, we want to leave but feel trapped. And finally, one comment noted, we need to find a way to be compassionate and safe at the same time. We wanted to include those just to frame the visceral approach that our neighbors, and that really goes for all of our panelists too, who either live or work downtown. And Dr. Keepers, you live up on the mountain, or you work up on the mountain. So we're all part of that downtown core, that fabric. Interestingly enough, the single largest theme regarding solutions mentioned is the need to consider a civil commitment mechanism to help those who are clearly suffering and unable to care for themselves. We will finish our Q&A session with an open discussion with all the panelists on this one topic. We will have 2-minute time limit per panelist and will notify you with 30 seconds remaining to wrap up your comments. I do realize that collaboration is necessary and needed, and completely understand if a discussion or a question from one panelist to the other would help clarify a point or result in better understanding for you and or our audience. I do want to kind of make one comment after the panelists and the presentations. Commissioner Myron, I really appreciate you calling out and taking ownership in the county, but I really want the rest of the panel, especially the state leaders that we have, the local leaders with Mayor Wheeler, and certainly with President Peterson, to recognize the ownership is there. I appreciate it, but we all have to work out of those silos. And that's what we're here to talk about, is not to point responsibility, but to say, here's what's going on there, and here's how I can help. The comment stated earlier about, I've been to these meetings before. The overall goal by bringing so many jurisdictions together is for us to work together, not to point fingers. And so let's go ahead and begin. And while Christy at the beginning did not mention Housing First, she did in her emails to us as we were prepping and going through the questions. And so I just want to call that out. And the first question we have is Housing First realistic right now? The federal government, state, and county have all adopted a Housing First model. This model prioritizes permanent supportive housing for those experiencing mental illness and substance use disorder over shelter. Portland and Multnomah County have well understood constraints when it comes to providing affordable housing in the short term, including high land costs, a bureaucratic permitting system, and the need for seismic upgrades. It also has one of the highest unsheltered homeless rates in the country, as well as one of the highest per capita addiction rates, coupled with the lowest available treatment rate. And now, because of fentanyl, in Multnomah County, there were 616 overdoses in June, 3 times as many as there were a year before. A significant number of these overdoses and deaths are among the homeless, who are left waiting on our streets for up to 6 years for housing. We cannot wait for Housing First to address the dearth of behavioral health services, the hard drug use emergency, and the climbing unsheltered homelessness crisis, which now has over 3,000 unsheltered souls sleeping on our streets tonight. Our question, and really the question that Christy wanted to make mention, because Kenny did have housing for a time, what, if anything, would each of you do differently to address the immediate need for shelter and treatment while permanent affordable housing is being sought or built? Mayor Wheeler, I'd like to begin with you, to follow with Commissioner Myron, then President Peterson, Representative Dexter, and Senator Lieber. And if you could please start the clock at 2 minutes, Eric, I would appreciate that. Mayor Wheeler.
Thank you. First of all, I can't answer the question in 2 minutes. I don't know how I possibly could. So let me start. I also want to address the email that you read before, because I think it highlights a considerable gap here. Do local leaders, do Portland leaders, that's what the email said, have the conviction and the courage to do what's necessary to address this problem? So there is broad belief that this is solely a local issue. And I cannot understate the degree to which local government takes this challenge seriously, to the degree that we've adapted. For example, we have created brand new sheltering sites, temporary alternative shelter sites, that aren't just a homeless camp where people go. It's a place where people get case management. They're referred to behavioral health, substance use disorder treatment, basic health care, and ultimately navigated to housing that's reserved for that population. It's a new model. It will be done at scale to address the magnitude of the problem on our streets. To make it work, obviously, we need to work with the county. Until we have that partnership solidified, we are actually negotiating for those services on our own through third-party providers. With regard to policing, we've increased the number of police. We've increased patrols. We have funded private sector patrols in hotspots throughout the area where drug use is a particular problem. We have done our 90-day resets in certain geographical areas where we have significant problems. Our fire bureau has responded. We created the Portland Street Response. We have directly funded treatment, even though that's not necessarily part of the city's formal operations, but we put over $1 million into the Bybee Lakes treatment center. We have just recently launched navigation teams, outreach teams into some of these hot spots. That's Urban Alchemy, who's running our task sites. They're now going out and they're meeting with people who are homeless on our streets. They're building trust. They're connecting them to services. That part of the model is non-punitive. It's just to build trust that is necessary to get people off the streets, to get them whatever help they need to get off and stay off the streets. But ultimately, it's about compassionate responses and enforcing our public right-of-way rules. It's both. That's what we're doing at the local level.
Thank you, Mayor Wheeler. I appreciate that. Commissioner Myron?
Thank you so much, Keith, and also Mayor, for your comments. We are facing a couple of things. First of all, there is a lot of misunderstanding and misconception by both proponents and opponents of Housing First. I have done some deep research on this, and there is a memo on my website at the county that will highlight some of those issues. But regardless, we will not have enough Housing First or otherwise, whatever it is, for years for the thousands of people living unsheltered outside, suffering from addictions and serious mental illness. So what are we doing in the meantime about this public health, public safety, and humanitarian crisis? What we need to be working on together, what I've been, that I think is really essential, is a holistic ecosystem of shelter options that does not focus on one type of shelter, because one size does not fit all. And frankly, we can't afford to say invest in all motel shelters or all of traditional indoor shelters. We need to be thinking strategically, thinking ahead to create a plan so that we can put those pieces together. Otherwise, we'll keep being distracted by shiny new objects and different opportunities when we need to come together, coalesce about the ecosystem. And I think, just to go to, Keith, what you mentioned, not calling on anyone out, I appreciate that. I also note that sometimes we have to have the hard conversations, because right now, as the mayor expressed, they're doing the county's job in some places because the county has not been acting under its own authority according to its responsibility. So we need to be able to acknowledge this, understand who's responsible for what, and put those pieces together collaboratively.
Thank you, Commissioner. I appreciate it. President Peterson.
Thanks for the question. The supportive housing service measure really has helped the 3 counties coordinate the homeless shelter and ongoing funding for existing beds, as well as for new construction. And between all 3 jurisdictions, all 3 counties, we have 1,400 beds that are either ongoing or new, which is great. And a lot of what needed to happen was also on the first step to getting more permanent housing, right? These shelter beds, they needed to be in the other 2 counties and not all in Multnomah County. So at the end of the last quarter, again, at the basically end of the 2 years, the first 2 years, there are 497 new shelter beds in Washington County, which is incredible in terms of what this money has been able to accomplish in a very short time. And we'll talk about why I say that in a minute. And there are 140 beds that are new into Clackamas County. They're about a year behind Washington County and Multnomah County in the actual implementation, but they are moving forward, which is great. But I also want to really point out that the siting of shelter beds and shelters is difficult. I don't need to understate that to the mayor or to the commissioner. It is very difficult to site these. Washington County and Clackamas County have both had massive pushback from neighborhoods, both on the community engagement side as well as the perception of safety. So that's why I say it's great that we are at this point where it is a tri-county solution. We have also convened a table, the tri-county planning body, as part of this work, which is going to work towards regionalizing our efforts through a combination of innovation and building structures that can serve people now and into the future. Metro's also working on a host of other ways to make sure that we have more housing in the region, and I would love to talk about that in another question. Thank you.
Thank you, President Peterson. Representative Dexter.
Thank you. We must address the urgent crisis in a short-term sort of focused way, and my colleagues have already addressed this in a lot of ways. We need shelters, we need crisis management. I would say that what I've heard from a lot of people in my community is I see someone in need and I don't know who to call, and no one comes if I do call them. We have to have a crisis management system that is connected to the supportive housing, as well as substance use and mental health treatment options that we desperately need. I do think that detox facility, there are gaps, and Senator Lieber spoke to this. We need to identify those gaps and we need to fund them. So I do believe that we are effectively identifying that need. Now we need to pivot to actually figuring out what those gaps are and doubling down. Housing first must be accompanied with the services, and putting someone in housing who doesn't have access to the services they need will not be successful, just as Christy expressed. I do still believe that food and shelter are foundational, and without investing in those and without making sure that people can live in community in a supported way, we will not solve this issue. There is much more than just putting someone in a room to living in a foundationally safe and healthy way. And there are differing needs, and we need to be really responsive to the needs of our communities. And the best solutions will come from our community members, and we need to listen and we need to continue to iterate. And as a housing chair, I will continue to build housing with my colleagues across the state as quickly and as effectively as we can, because until people can afford housing, this will continue to be an issue. Thank you.
Thank you, Representative. Senator Lieber.
Thank you so much. I agree with all of the things that our panelists are saying. We need to look at we need investment in all levels of housing, right? And that is from single resident occupancies all the way up to workforce housing. And that housing production is something that we've been paying a lot of attention to. In the last legislative session, we have made siting of shelters a bit easier. We had a bill that allowed for RVs to stay on rural areas. We increased the ability for converting commercial buildings to residential, but all of these things, like, they just passed, and it's going to take time to actually make it into a reality. What I think is happening here is we have been chasing a tsunami, right? We know that we've had issues with housing, for many, many years. We know we've had this coming up, and we just are continuing to sort of chase this. I think the governor putting together the task force that she has on housing production is a really, really great step in trying to figure out what are the things that we can do at the state level to remove the barriers that we have so that more housing production can get started, and what areas do we as the state need to invest in order to make more land buildable for housing. So we have all of these things that are happening, and housing is going to take years. So in the meantime, we have to continue to invest in shelter. We have to invest in shelter. We have to invest in all levels of shelter, and we have to continue to figure out how we can make it easier to house people.
Senator Lieber, thank you so much. To paraphrase the questions, and we were really inundated this last couple of weeks with questions. The housing first topic came up often, and then there was the focus that should we be focused on shelter first? And in the end, I think what to take away from the questions is just a roof first. That was what the framing was, because we have 3,000 souls tonight that aren't going to be protected. So thank you for that. I appreciate that. We're going to move on to treatment. And Dr. Keepers, I'm going to ask that you jump in at the end after our 5 panelists. And then I'd like to ask you a specific question just about your local location up on the hill. This is regarding treatment. We see people dying from an overdose, revived with Narcan, regaining consciousness, and walking away only a few moments after being brought back to life. Sobering centers and their 24-hour non-voluntary holds offer an opportunity to provide treatment assessment, a conversation with a person who is cycling downward, and deterrence. Most would agree that treating substance use disorder requires a continuum of treatment and care, starting with the critical step of stabilization, either sobering or detox. Because each requires medical treatment, it requires special facilities, staffed with medical and clinical professionals. Sobering centers allow an intoxicated person to come down as an alternative to jail. Detox initiates the treatment process. I want to talk about the economic viability of a sobering center. For context, it costs about $200 a day per person for a sobering center stay versus the high end, which is an ICU unit, at $7,000. There are Medicaid waivers that have been approved for larger institutions to be reimbursed for this service. The state has approved funds to supplement the Medicaid reimbursement, yet we will have no 24/7 access to either of these options needed after at least 3 years of effort. So the questions for our 5 panelists are really twofold regarding sobering centers. Why do we not have a sobering center after available 24/7 as an alternative to jail? What is needed to stand it up? And then the second, regarding treatment facilities, what can the state and Multnomah County do to induce existing detox facilities to expand and others to build new capacity? To recognize Mayor Wheeler, 2 minutes is not nearly enough. If you just want to target and tackle the sobering center, I would say that would frame most of the questions we have is where can we help these people go rather than on my corner as they're fading away and then being revived. Let's begin in a reverse order. Senator Lieber, would you mind if I call upon you to begin and then we'll reverse it?
No, that's fine. Thanks, Keith. So we do need more sobering centers. We are standing up sobering and detox centers. I think the first one in Portland is going to open coming up fairly soon, or has already opened. But you're absolutely right. Here's the big takeaway, though, is a lot of the detox that we had, like say for Hooper, for example. Hooper was a detox center that was something when I was prosecuting cases that we utilized, but it was for alcohol detox mostly. We have got a very different detox need with fentanyl and with meth. It is a different animal altogether, and it takes different expertise to have it. We have a workforce shortage. We put lots of money out for RFPs for which is for people to come in and sort of say, hey, can you build X for us? And we can't get people to either do the RFP and they can't get workers to work it. So we have this problem where we are dealing with a meth and fentanyl addiction crisis in a system that was underfunded for many years. And now we're trying to stand up many of these centers, which we absolutely need. And we know that we need to have this piece of the system that we're missing, and it cannot be set up overnight. And it's more than just about money. It's about getting the expertise, and it's about getting the workforce in place in order to set these centers up.
Thank you, Senator. Representative?
Thank you, Keith. And having quoted that it's $200 a day estimated cost versus $7,000 a day in the units where I work every day, I appreciate the difference of expertise. I will also say that we are the de facto sobering center for a lot of folks because our EMS system doesn't have a place to take people. I was at a listening session at Good Samaritan after the shooting there recently, and the nurses there are in crisis, and they say jails will bring people to us who are too violent or unsafe to be kept in jail, so they bring them to us. And I am not trained for this. This is not what I do. And that is really, quite frankly, part of the reason we have such a healthcare shortage is we don't go into medicine to take care of people who need to be detoxed and restrained against their will and sedated to keep them from hitting and spitting at us. And that happens every day. I rush in and take care of patients who are trying to get out of bed, and then I get hit and spit at and all the things. We cannot staff a sobering center. They are not safe. People don't have the expertise. We have to train people, and this is not a simple issue. And I remember when the Hooper van would go around and pick anyone who was sleeping on the street up, assuming that they were intoxicated with alcohol, and take them where they could be warm and safe until they were able to wake up and leave. That is not what happens with P2P meth. People are violent, they're unpredictable, they are in crisis. And so this is not a simple issue of just building it and putting people in there. We have one-on-one patient sitters is what we call them in the hospital when people are restrained and violent. And then we have a team of people who have to come in, and it's 6-7 people who have to intervene when they get violent. We have got to find those workers, and I don't know where they're going to come from because we don't have them in the hospital, and that's a much different job.
Thank you, Representative. President Peterson.
Well, this is one of those examples of where Metro should just stay in our lane because we have experts across this panel that are really digging into this issue and implementing it. And where Metro can be helpful, we would love to, such as the Tri-County Planning Body, so that we're sharing information of what you all learn with the other 2 counties and see how that plays out. The supportive housing service measure. I know there's been discussions about whether this money can be used for that or not. And it's really, if it's attached to housing and somebody in a housing situation. So it's a little dark gray of whether it could be used. But I think the conversation is out there, and Metro is pleased to be part of it at the Tri-County Planning Body.
Thank you, President Peterson. Commissioner Myron.
Yeah, so this one involves many hats that I wear, and in particular as an emergency physician, see people so often who come into the emergency department, alternative is jail, and all they need is sobering. Sobering is the old time equivalent of sleeping it off, whatever it is. Detox is actually coming off the substance, going through withdrawal and being managed on that. And then treatment is sort of ongoing after that. So we have a continuum. A lot of people use these terms interchangeably. They're not interchangeable. And what we invest in needs to be determined by actual need and opportunity. So we still need a sobering center. I will speak as an ER doctor, and I will tell you that up front. And it needs to be different from what it was. And it can be. There is a national sobering collaborative, convenings of experts on this. I'm going to a conference in DC, October 5th to 6th, where we will be having the conversation about standards, how different counties are doing this across the country. But we need this very much. I think of this less as a behavioral health issue, more as a public safety issues. First responders are desperate for somewhere to go that's not ERs. And the capacity that I'm grateful to Providence and to Unity for creating more beds adjacent to their ERs, a few of them. We need so much more capacity. But I also want to point out, anyone going to a sobering center could not go to an ICU. Like that's sort of comparing apples and oranges, because you have to be pretty stable, completely stable to go to a sobering center. So we need the people with the expertise understanding these issues to connect with the governments responsible, put those pieces together. But I am pushing for a sobering center in the county.
Thank you, Commissioner Myron. Mayor Wheeler.
Yeah, I want to copy Commissioner Myron's comments because I agree with everything she said, but I also want to agree with President Peterson. This is not an area of great expertise for me, except what I've learned as mayor. I went out on a ride along just a couple of days ago, and I watched a guy come back from the dead. He was revived with Narcan, and he stood up, and as soon as he got his bearings, he punched the individual who had just saved his life. And he wandered off, and the officer with me said that is a common reaction. Why? Senator Lieber nailed it. The reason we don't have a sobering center is the people who used to run the sobering center were trained to run a drunk tank. That's what it was. And now you have people under the influence of P2P meth, antisocial behavior, extreme paranoia, violent outbursts. They are dangerous individuals when they are under the influence to themselves and everybody around them. So the old sobering center model does not work. Fental's a little different. People look like they're just dead on the sidewalk. They too need to be revived, and they too can create some safety issues once they are revived. The city has supported funding. We support the collaborative effort that's currently underway to reinvent what the new version looks like. I'm really appreciative of Sharon, Commissioner Myron going to DC and collaborating with other counties to talk about what this next model is. And I'll just say here at the city of Portland, we say, amen. We'll help in any way we can. We need it. We need it yesterday. And we stand by ready to be solid partners.
Thank you, Mayor Wheeler. Dr. Keepers, hold on for just a second. I just want to follow up on this with Commissioner Myron and Mayor Wheeler. And Representative Dexter hit it on the head. It's vicarious PTSD that are being experienced. And prepping for this question, I was talking to the city attorney of San Diego, and they had noted that they offer a premium of 30% for wages for their psychiatric help in the sobering centers. But I want to just ask the two of you, specifically, Commissioner Myron, do we have a plan on the table that we're looking at this in 3, 12, 2 years? What is our plan? We know the problems. Yeah. But what is the plan? When can we expect the sobering center? It's a missing item on our continuum of care. Do we have anything on the plan? Can you give us any dates? And that really goes for you too, Mr. Mayor. And I recognize it's a county, but obviously we want to cite it in Portland. Commissioner Myron.
Yeah, no, and this really is an opportunity for true collaboration with the city and county, because it is that overlay of public safety and behavioral health. And both myself and Commissioner Brim Edwards at the county have proposed, like I said, our problem right now isn't lack of funds. It is lack of a plan and places to use the incredible amount of money that we are coming into. Both of us have proposed using some of I believe the Supportive Housing Services funds. We also have unused ARPA money, around $12.7 million that we can invest right now, that the county is deliberating on, along with some money left over from an old project called Beacon, that whole other thing. We have the opportunity now. You can opine and give your perspective to say, this is a priority. We need to fill this gap, purchase the facility, the place now with the money that we have that's one time only, so we can plan for the future to use this as a sobering center.
But we don't have any time frame on this though, correct?
Oh, it would have to be, I mean, we'd have to invest the money in the next year. And if we build it, they will come. If we invest in this, the plan, as the mayor said, there is so much momentum and support behind the idea of a sobering center. So it's not for lack of that. Yeah.
Okay. Thank you, Shannon. And Mr. Mayor, you can answer, but I think.
Can I weigh in too? Because there's
by all means, yes, please.
Ballot Measure 110 money actually did go towards a sobering center that's going to open up. It's called the Foster Road Detox Center, which should be open in the next few weeks, is my understanding. And that was funded through the ballot measure 110 money. The thing that's about that is that it's going to be a 16-bed sobering center.
Mhm.
And if you recall, with Medicaid funding, the way that that works is that one of the things that we have to do is keep it 16 beds or under in order to draw down the Medicaid match. And that's what this center is.
Not for sobering though. Not
Yeah.
for sobering
is
and this,
detox.
not detox.
Right.
So
Yeah,
we're
Sharon, this
talking
is detox.
different
though,
languages.
Which is
Yep.
100%. You're absolutely
Yep.
correct. Thank
Yeah.
you for that.
Yeah,
No.
you're-
But detox you do, but you're absolutely correct, not for sobering.
and
Senator, thank you for jumping in, and that's exactly what I was hopeful for, is just the understanding of this. This is exactly what I was hopeful for. Mr. Mayor, you can jump in, but Commissioner Myron she was clear.
Yeah. I'm not going to repeat anything anybody.
Okay.
Plus, those guys are actually experts. I'm merely a commentator. But I will say this: they both underscored an important point from my perspective at the city level. They talked about Medicaid funding, and they talked about the supportive housing measure at Metro funding. The city gets neither. I want to be very clear about this. The money we invest, whether it's in homelessness services, whether it is in behavioral health services, substance use disorder treatment, whatever, that dollar is our highest value dollar, which is our general fund dollars. Nobody reimburses us for that. The general fund dollars would otherwise go to police, to fire, to 911 emergency response, and general emergency management. We are now spending $40+ million on the Joint Office of Homeless Services out of general fund. We spent $29 million initially on our first task site, and we continue to spend money on these other interventions like the Portland Street response. So I just want people to see clearly, I'm not going to edit this. I'm not going to sugarcoat it. The more we invest at the local level, at the city level, that is not eligible for Medicaid reimbursement or for SHS reimbursement, which is determined by the county, not the city, it's coming right out of your public safety budget. And I'm deeply concerned about that. And that's why I'm glad to see sort of this air of collaboration, this desire for us all pull together and create a system that's workable and do it yesterday.
Absolutely. Thank you, Mr. Mayor. I appreciate that. Dr. Keepers, I'm going to ask you something specific. Again, it's about Sobering Center, and you had pointed that out in multiple points of your email to us in prepping for this. And so my question is, as a university and a hospital based near our downtown and with a program focused on fentanyl research, so in other words, it's something that Representative Dexter and Senator Lieber, the real horrible causes of fentanyl, you're the expert, your department's an expert in that. Is this an opportunity to provide a sobering center and both gather research and care for the community you're based in? I'm kind of putting you on notice there with your expertise. It seems like it's a good fit. Is there any possibility, or do you have any recommendations on how the county can get a sobering center up in our community?
Well, I have a few comments anyhow. First of all, the fentanyl research that's being conducted at OHSU is primarily epidemiologic. It's based upon databases where the researchers have looked at various questions about fentanyl. That's as opposed to the methamphetamine research center, which is in my department, where we are really examining the basic science of methamphetamine addiction. OHSU already sees lots of patients for detoxification. If you were to go to our emergency room like the other physicians here have talked about, you would find patients literally in the hallways because we are so overloaded with this problem. And many of them are medically ill and make it onto our general medical and surgical units where they need psychiatric consultation. So my point here is that we're doing a lot of this work here at the University Hospital. We also do a lot of this kind of work in the psychiatric emergency service at Unity Hospital, which not everybody may know, but that hospital is a collaboration between OHSU, Legacy, Adventist, and Kaiser. And we provide all of the psychiatrists and nurse practitioners who work there from the faculty of the university. And much of the caseload of that emergency service is occupied with this kind of work of detoxification of people. We are going to open some beds, additional beds at Unity. The timeline for that is probably spring, summer of next year. We are already recruiting personnel for it, and I can guarantee it's difficult to recruit
Yeah.
people to do this work. Very difficult to find people who are expert and who are willing to practice in these situations. Along that line, OHSU has two programs that train people in this. There's an addiction psychiatry program in my department and an addiction medicine program, both of whom train experts in this kind of work. So we are able to provide some of the personnel, the leadership for programs like this.
Thank you, Dr. Keepers. And I want to kind of drill down on that same question I asked Commissioner Myron and Mr. Mayor. The Unity individuals you mentioned, those are for detox, correct?
That's correct.
Okay.
That's
So
correct.
to the point that the members and the audience had really noted is just the dearth of need, the dearth of sobering centers. That's kind of one of those critical parts that we were hopeful to see a resource coming online.
Yeah, so I would expand that actually, Keith. What you need is a continuum of care. It does not much different. It doesn't do much good to detox somebody or even to have them in a sobering center for a period of time and then discharge them from that into a lack of follow-up care for them, a lack of housing, a lack of adequate financial support, a lack of treatment. Because that's a prescription for them renewing their addiction.
Right. And to just give a rebuttal on that, Dr. Keepers, when I asked Chief Lavelle about this and I talked to him about the 3 young people that passed away on Washington Street a couple months ago, incapacitated on the street, we didn't have a place for them to go. And oftentimes we're not stopping to check on them at that point. And I don't want to drill down on this more, but it was a lot of questions that we got regarding that. Let's move on to continuum of care. We often see people using fentanyl with hospital bans still on their wrists. One of the missing treatment options is post-detox residential shelter, where people suffering from substance use disorder have an opportunity for non-medical shelter free from the triggering impacts of returning to the streets, like Bybee Lakes Hope Center and the Central City Concerns Blackburn Center, that provide holistic residential care and program to help people complete their education, secure a job, and obtain stable housing. Yet these proven resources remain scarce. And as an aside, we have been watching the Bybee Lakes funding, of which Multnomah County, I'd like to mention, Sharon, that have been, you've actually started to fund at a higher rate, and we are appreciative of that. Question: what is the most immediate option for this, and how can the city and county work together to create such a facility or facilities so people aren't being discharged to the streets while they await housing? And Mr. Mayor, may I please start with you on that?
So on this one, I want to defer to the experts, but I'll just say from a common sense perspective, it makes perfect sense to me that if you're going to take the time, the energy, the money, the personnel, the resources to put somebody through an extensive, and I'm told fairly painful detoxification process, that at the end of it, you want the support services to ensure that they remain successful. For some, I would assume that's continued medical care, although I'm going to defer to the experts, the subject matter experts on this call. For others, it's ensuring that they have a stable place to live. I'll tell you what the wrong answer is. The wrong answer is let them go back to the streets, let them go back to the dealers, let them go back to the environment that contributed to or maybe even fundamentally led them to the door of the detox center in the first place. They need something stable, something new, something different. They need to be hopeful, have access to job training, to people who will support them on a continual basis. Maybe it's other people who've gone through this extensive and difficult process who can help coach them, and they can help coach them, coach each other. Just some sort of a support network. But I just want to make sure people don't go back onto the streets.
Oh my gosh.
Mr. Mayor, thank you so much. Commissioner Myron, it's okay, you're up.
Thank you. Sorry, I realized my mute wasn't on. So I could not agree more with the mayor. It sounds like you actually got some expertise there, I have to say. and this ties in so well to the rest of the things we were talking about. So for sobering in my mind is safety. Might not result in a change of someone getting into housing, may or may not, but at the very least, a person would otherwise be lying on the street that someone will walk over, will be in a place where they're observed and monitored, and can be sent out safely. So that's safety. Detox and treatment, I could not agree more. There are so many times people talk about treatment and that we have to invest in more treatment and more treatment. The thing is, there is nowhere for people to go as it is with the minimal amount of treatment facilities we have right now. So people go through that horrific process of detox, and then at least a third of them, but in reality, probably more, are discharged right back to the street. It is a revolving door and nothing will change. So not only is the person in a worse situation, that money on detox is wasted. We need the places for people to go. This is where Crowne Plaza comes in, I will say, as a very specific facility. We need recovery-oriented housing with the true supports people need to transition over a long term, so they're ready to move into housing and to thrive. It would include job training on site, which Crowne Plaza has, with commercial kitchens and all kinds of space for training. It would include wraparound services with groups and community. We know community is the most important thing for people who are trying and being sober. And in a sober community, the recovery community is most important for people trying to get off drugs and recover. And we keep saying we can't, build housing overnight. If we bought the Crowne Plaza, we would have it, and that could be put into play with 241 rooms furnished already to be a recovering housing center. So, and all the issues about the whole seismic stuff are not accurate, and that information will be coming out.
Thank you, Commissioner Myron. President Peterson?
I'm very happy to be part of this conversation and listen in on the efforts of my partners. But Metro, again, as long as it's part of the plans from the 3 counties for the supportive housing service measure, we are all in and helping in any way we possibly can. Again, I think Metro's role beyond the supportive housing service measure is on getting housing built in this region and getting living wage jobs. So we can talk again a little bit about that later.
Thank you, President. Representative Dexter?
Thank you. Blackburn Center is a model that really works. And we know that if we at the hospital discharge a patient to Blackburn, that they will get the services they need, they will be transitioned into housing, and that they have a network of services. That's why in 2021, May of 2021, my colleagues and I allocated just under $4 million to Central City Concern to replicate Blackburn Center out of those ARPA dollars to build a similar facility in Old Town, and Central City is working on that. And that was in May of 2021. And, we still are working there. So these things take time. I'm very supportive of the efforts that Dr. Myron and Commissioner Myron and others have elevated around Crowne Plaza. I do have questions about security and safety and there's challenges there, but I do agree that we need those transition facilities, and respite is real. Like, I did my training at Harborview in Seattle and at Denver County or Denver General in Denver. Those were major cities where we did have access to respite centers where people who were houseless or housing insecure, who needed low-level medical treatment, could get that treatment. You're not going to stay out of the hospital if you have a foot wound that you need to dress. If you're houseless and walking, without attention to that wound, you will end up right back in the ICU or wherever it is. Unfortunately, sometimes people don't make it back to the hospital. So this is a huge need. We are investing in it. I know know that Senator Lieber can speak more to that. We understand that those investments take time to come to fruition, and we all want them now. Unfortunately, starting around the 80s, we really disinvested in this, and we're now really trying to recover from that. And sadly, it's impacting all of us.
Yes, thank you, Representative. Senator Lieber.
Thank you so much. I mean, I couldn't agree more that we have what I phrase in our system is leakage. And I was really concentrating when I first came in 21 on what was happening in the state hospital. And it's the exact same thing where we would spend a lot of money to have somebody be in the state hospital, and then 2 months later, they're homeless. We cannot continue to have this kind of sort of leakage in the system because we don't have warm handoffs. We don't have that coordination. But I will tell you that we made huge investments in trying to stand up secure residential treatment facilities, housing facilities, and we put out a request, an RFP, a request for proposal out in 21. And we still have not been able to stand those things up for a whole variety of reasons. One of which is very difficult to site. It was very difficult to get workers to work at those facilities. And it is, we don't have enough people who are actually sort of willing to do that kind of work. I'm going to throw one more crazy barrier in here, which is insurance. It is getting extraordinarily difficult to actually get insurance for these kinds of facilities. So that's our commercial insurance market that's also become a barrier for us opening up these facilities. That being said, we have a lot of money that has gone into the system. There are facilities that are getting stood up with this money. They're not online yet, but we have to have a coordinated effort on figuring out what is the system we want. We then have to do a gap analysis to figure out where the gaps are in the system that we want, even if we can get some sort of agreement on that. And then we have to figure out who's going to pay for it. And that's both state, local, our coordinated care organizations through Medicaid. And that's really, really difficult to parse out. And I think that's the difficulty that you're seeing here with these elected officials who were all trying to do what we can do at our stage of government. And we all know that we have a problem and we're all trying to solve it.
Senator Lieber, you hit on one of the things that Central City Concern has noted as one of their major concerns is insurance. Insurance is being pulled. The homeless services agencies or CBOs really need to talk about creating a pool for themselves because their rates are going up and they're having difficulties with that. Interesting you bring that up. To summarize,
we have a work group.
Great.
A work group that's working on that. In this last short session, it was something that was really incredibly important to me, and we actually did what I would consider a stopgap, but it was something that we needed to do to make sure that we could get insurance. We modeled it after the insurance companies that, with all the wildfires in California, they were having problems getting any kind of insurance out there. And what we did is we put money into a fund at the state level where it's a backstop so that counties can get insurance. They only need to get insurance up to a certain level. But we have to, this is another place that we have to figure out this insurance thing, or we're not going to get anybody to be able to open up these centers.
That's exactly right. Senator Lieber, that's exactly right. It's a huge opportunity for innovation. We have hundreds of millions, if not billions of dollars available, but we don't have the personnel. We certainly have the structures. We've got to get them built. We certainly have the will, the desire, and the need. It is ripe for innovation. We're going to move on to Measure 110, and this is a focused question on changes or repeal. It is safe to say that Measure 110, the drug decriminalization law passed and implemented 90 days later, has not met the original expectations of the sponsors or the public at large. Fentanyl has led to the growth of cartel activity in Oregon, and the illicit supply has led to large increases in overdoses, open drug uses everywhere, slow or no emergency response, crime seems normal, and residents, visitors, and businesses are frightened and hurting. The emergency continues to grow despite harm reduction efforts. While we lack good data, there's anecdotal evidence that decriminalization has been a magnet attracting people with substance use distress from other states. Some are calling for complete repeal, others for modification. So I'm going to ask you this question, and then I'm going to ask Mayor Wheeler at the end if you could just maybe tie something on to it as well. The question is, would you keep, change, or repeal Measure 110? If not, what, if anything, would you do to modify it to address the substance use disorder and the emergency in our communities? Again, would you keep, change, or repeal Measure 110? And then, Mayor Wheeler, I had the great pleasure of meeting with your attorneys last Friday. We were primarily talking about confiscation. I know we talked about it at council a couple weeks ago. If you could make a mention on that, it would be great. If not, I perfectly understand, but I just wanted to note that changing the law, which we hope to do, is still 6, 9, 12 months out. And there's no guarantee that our legislature will do it or show up, for that matter, with all due respect. But we have an emergency today. Anything we could talk about to the panelists would be much appreciated to really help on what's the crisis and what can we do today. So thank you very much for that. So to begin, let's start with Senator Lieber, and then we'll move on to Maxine in the same order. Thank you.
So, thank you for this question. I think that what I want to do is sort of decouple 110 from really the big, huge issue that we have going on. We have a fentanyl and meth addiction crisis. We also have open air drug market in the city of Portland, which is unacceptable. So there's a couple of things. What I understood, what I took away from when the public passed ballot measure 110 is they wanted us to treat addiction as a public health crisis, not as a criminal justice crisis. And we know that treating 110 in the public health arena is can be something that is better for the person who you're treating. But we have to have the resources, and we have to have those treatment centers that we've been talking about and that continuum of care set up. We don't have that. All right. The second thing we need to have is we have to have accountability within that public health response, and we need to have more accountability. We also have to be able to arrest and prosecute the supply side of this, which I am going to phrase as our criminal justice response. There is a case that came out called Hubble that happened in 2021, which was I'm going to get a little wonky here just because I'm a former prosecutor. But this Hubble case, what it did was the Court of Appeals took away what I consider to be a tool for the prosecution with regard to prosecuting delivery of controlled substances, which continues to be a felony. That I feel that the legislature is going to need to look at giving back that tool to our police and our prosecutors. But that happened at the same time. And what I mean by us like chasing this tsunami is that we're sort of getting hit with these additional sort of waves of problems when we don't have the system stood up to support it. And then I would just say that I don't support us just getting rid of 110 wholly. The legislature has continued to make adjustments to 110, and we will continue to do so because that is what we should do. We should be looking for solutions, and we need to be solution oriented. But 110, the money of 110 only got out about a year ago. I don't think that we've seen yet all of the many things that it is standing up. So that is yet to be determined. And as we go down that road, I think it's going to be important for us to continue to look at it. We can talk about public use if that's a separate question. I don't know that you're going to have that as a separate question, Keith. But I think that public use is something that we have to look at whether or not we're going to recriminalize it. Look, I'm a former prosecutor. I believe that the criminal justice system has a piece of this, but I also know public use can drive people indoors, and where are they going to go? And I worry about that. On the flip side, we have to give the police the tools they need to start confiscating drugs. So it is something that we are struggling, which I think that we should continue to talk about and struggle through. And you're absolutely right. It's going to take some time for us to do that.
Thank you, Senator Lieber. And certainly As a prosecutor, I appreciate your perspective. It's a dilemma for sure. Representative Dexter.
Thank you. So I very much support the voter approved Measure 110 effort and the desire that our community had to make drug addiction, substance use disorder a public health issue as it truly is. We have tried the war on drugs. We've had 50 years of criminalization of addiction, and it doesn't work. We are in this position because it doesn't work. You add to that fentanyl and the immense increase in addictivity, addiction readiness that it induces, and the deadliness, and we have what we see right now every day. I believe we need to use the tools that we have at hand while we're also building new tools. So Measure 110 is not perfect. House Bill 2513 was trying to iterate on that and improve on it. We continue to need to look at the data and look at what's working and double down on those and disinvest from things that aren't working. I will continue to say that epidemiology and public health information is going to help drive this because it is a public health issue. And to Senator Lieber's point, it is not legal, and none of us support having people dealing drugs openly on our streets. It is a felony, I believe, the senator will correct me if I'm wrong, to do so. We need to arrest and deter further open use in our community. I did the Oregon Recovery Walk yesterday. I was right next to where you were talking, a block away from Nordstrom. There were police visibly 1 block away, and there was open dealing and use right on the corner. Like, we are not deterring anyone. We need to use the tools we have, and it is not legal to deal drugs. We need to take care of that. We need public defenders to prosecute those issues, and we need to make it so that public use is not acceptable, and without criminalizing those who are homeless and addicted. I would say we need to have overdose prevention sites that are available to people 24/7. I know that that is a sticky issue in a lot of ways, but if we don't get people out of the shadows and offer them harm reduction and opportunities to get into treatment, we will not solve this issue. And we will have people dying in Starbucks bathrooms and in other places because they're afraid to do it on the street. So again, complicated issue. We are very much willing and already working with our city, county, and other officials to address this. And I will be here for the duration to make sure that our community feels safe and healthy again. Thanks.
Representative Dexter, it's great to hear you're out on the street, and that's really what it's going to take. And then putting that into policy, that's good work. I'd like to move on to President Peterson.
Yeah, I'm just going to support both the senator and the representative on their comments. I agree 110 wasn't perfect. And I'm glad to hear that there are tweaks being made. I think there was intent in the ballot measure, and there are things that we need to be made more clear, and we definitely need the treatment programs out there as quickly as possible. So I'm glad to hear that we're moving towards the fixing and trying to clarify what we need to make it work in terms of public safety, because as the mayor will say, downtown Portland and East County need that clarification as soon as possible for livable and safe neighborhoods as well as downtown.
Thank you, President. Commissioner Myron.
Yeah, I have a little bit of I think a different take. Just in terms of Measure 110 rollout not being perfect or needed tweaks, I would go so far as to say the rollout of Measure 110 was a disaster. And I've described it as criminal negligence virtually on the part of the OHA and how they allowed that to roll out, compounded by a perfect storm with fentanyl and meth. I know there's, it's always referred to as the voter approved Measure 110, and I was one of those voters who approved it. But if I knew then what I know now, I would never have voted it. So the voter approved thing is a little touchy for me. That being said, implementation has caused so much disruption in our systems, has caused so much challenge and restructuring that at this point, I do not believe we should repeal it. We need to fix it, but the key is teeth. It's been described, I know addiction is described as a public health crisis. I've called on the county, the local public health authority. We could declare this a public health crisis and open a number of opportunities to support getting people into treatment. But again, treatment without recovery housing, the place to go next, won't work. And I would point to it on the individual level. Addiction is a chronic relapsing medical illness, and it is characterized by the negative impacts of the illness on people and society, and the lack of control caused by biochemical changes in the brain. And so the elephant in the room that needs to be discussed and brought into the light is the fact that on the one hand, some are saying, treat it as voluntary, we need to do this as a voluntary thing to get people into treatment still. But by the same token, it's a chronic disease characterized by lack of control and inability to decide if treatment's appropriate. So we need to address so many issues here, but we need to reform, and reform means teeth.
Thank you, Commissioner. Mayor Wheeler?
Yeah, thank you for the puffball question. First of all, I oppose an outright repeal of Measure 110. And the reason I oppose an outright repeal is we need the treatment in our state. Our state is extremely limited in terms of access to treatment for people who need it for substance use disorders. So that's my view. I agree with Commissioner Myron. It needs to have teeth. My job is maybe somewhat unique in that I have to balance competing interests and competing rights, and I have to be specific about what I'm talking about. So on one hand, I want to balance compassion. There are people on our streets who are truly vulnerable. Their lives are in danger. They're at the low point of their life, and they need some options. They need a lifeline. They need access to treatment. They need access to behavioral health. They need access to other services, and we should darn well provide it. But I also want to be clear, the public at large has rights too. They have rights to egress their sidewalks, and there was a fairly substantial lawsuit we just settled around ADA access. People have a right to navigate their community and shop and play and work without the threat of somebody attacking them randomly because they're in a meth-induced psychosis. And so I lean on the side of give people options that are compassionate and workable, but if they don't take them, get them off the streets. And I feel very strongly about that. And I know I sound kind of like a jerk when I say that, but again, I'm balancing competing interests, and the public at large is suffering under this explosion of meth and fentanyl use in our community. I want to thank the legislature. We have a couple of legislators. Thank you for passing the possession issue around fentanyl. We agree with that. There's a next step, though. And as you know, the council has passed a use ordinance for all the rest that are currently legal to use on our streets. There's way too much of it, and we need the police to at least episodically, in certain circumstances or in hotspots, to be able to enforce getting people off of our sidewalks who are openly using drugs, which then cause all kinds of other illicit behavior that are causing businesses, hoteliers, employees, shoppers, people who live here to abandon their city. We need to turn the tide. And so I'm really asking you guys, help us, work with us, partner us with us on the use thing. We're not going to recriminalize drugs all of the 1980s, but the police bureau does need more options to enforce the law and clear our sidewalks in certain circumstances. And that would help us tremendously. Thank you.
Thank you, Mr. Mayor. I appreciate it. With the time we have left, it's 4:45. One of the interesting threads that we were looking at, and while it didn't say civil commitment outright, it just said, why don't we have something or some help for the individuals that are suffering before our eyes? And so it seemed like in every question we had, it did talk about the psychosis and the psychotic episodes that we would see play out. And so we're really going to spend this time, and I'm going to ask Dr. Keepers to come in. And this is kind of an unusual thing that we really want to do, is we wanted to bring all of us together to just talk about a change in our society and see what your thoughts are. You each have wide array of talent, certainly doctors and prosecutors, and certainly professional civil servants. Civil commitment reform and diversion to treatment. Most of us want to focus on treatment, not incarceration. And we have heard many stories of people who are experiencing mental illness that are resistant to treatment. Christy's story about her son, Kenny, clearly outlines that we do not want to wait for someone to cycle downward to the point where drugs are used to self-medicate, and in this tragic case, die. Is the legal standard for civil commitment in Oregon too high? Why do we have to wait for someone suffering from mental illness to commit repeated property crimes or even violent crimes, be arrested, often released from jail the following day, often fail to appear for their court dates, and reoffend followed by rearrest, with the cycle continuing? We have our Multnomah County Mental Health Court, but this is only available for the mentally ill after a crime has occurred and the person suffering has offended or hurt so many people in the process before they reach this threshold for help. We have many resources and laws already in place to implement a civil commitment program, a non-criminal response, and before anyone is hurt, including the person suffering from mental illness. We have concerned family members like Christy and Judge Wolke in Jackson County, who we interviewed for this question, whose 19-year-old son had onset psychosis and cycled out of control. We have the Portland Police Bureau Behavioral Health Unit, which by all accounts is a wonderful resource that we have that, of course, with only 4 or 5 souls, could be a great opportunity for funding to help those that are on the street and suffering. We have an assisted outpatient treatment law on the books for the last many years, but by talking to Judge Waller, Judge Wolke, they admittedly say it doesn't have teeth. And yes, we're working on teeth. From what I understand, there's a work group going on right now that our Chief Justice has committed. And then in 2025, they hope to add that teeth or those teeth. So a parent or a police officer who can create a 24-hour hold can help that person in the next step without releasing over and over again to move to the drugs for self-medication, so a family member can get help. There are examples through Kendra's law, which is New York, and then there's the new California Care Court that is specifically focused on people experiencing schizophrenia that will offer a voluntary program, but if treatment isn't followed, then to help with hospitalization or whatever the care or the doctor thinks that person needs for treatment, so they don't enter into the criminal justice system. So here's our questions, and Dr. Keepers, I look forward to including you on this. Let's talk about system change. Are we ready for a community conversation regarding civil commitment to help connect a person struggling with untreated mental illness and often also substance use challenges with a court-ordered treatment? You know, is there any hands? Dr. Keepers, do you want to start with this one? And
sure. I'd be happy to, Keith. So, the standard for civil commitment in Oregon is much higher than it is in most of the rest of the country. Psychiatrists coming here from other states are really astonished by the fact that some of the patients that they see can't be civilly committed. And that's historic to Oregon. That is a standard that is upheld so that we value autonomy of the patient much more highly than we value their benefit, frankly. So I personally feel that the standard for civil commitment in Oregon is too high, and it should be easier to get people committed. I also favor a system that has the option of outpatient commitment. And the problem with that, as you pointed out, is the lack of enforcement of that commitment. So that you have to have systems in place to make sure that people are complying with the treatment that is dictated by the court in order for that to work. And you have to have the people to treat them, of course. The other thing I'd say is that, as I said in my remarks, 35 states have a mechanism, a civil commitment mechanism for treating people whose primary problem is substance dependence, who have really lost agency and lost autonomy. As Dr. Myron has pointed out, addiction is a brain disease, and when it progresses far enough, people really don't have the choice about whether to continue using drugs. Much of the behavior that you see on the streets is a result of that. And there needs to be a mechanism for that group of people to bring them into treatment involuntarily so that they have a chance to recover.
Thank you, Dr. Keepers. Dr. Wolke said on Friday, of those who suffer from severe persistent mental illness, 70% of them will also suffer from substance use disorder. So it is a co-occurring item. While we can only focus on mental illness because you generally cannot use a civil commitment for substance use disorder, they really are co-occurring and connected. Let me thank you for that, doctor. That's the clinical point of view. Senator Lieber, let me turn to you from a previous prosecutor point of view, and you understand civil liberties. Are we ready for that? What are your thoughts? You can tackle this as certainly a mother, as a policymaker, or a prosecutor. You can certainly jump in on any one of those threads.
Yeah, thanks, Keith. As a prosecutor, I was the DA who would prosecute civil commits, and I did that tour as well. And I also saw firsthand at the Psychiatric Security Review Board where we did wait till somebody committed a really serious crime, and then we put them under the jurisdiction of the PSRB, and we gave them actually pretty good services under that. So I know that there have been others in the legislature who have looked at this continually. I know that Judge Waller has been on a civil commitment work group. I know there was a work group to look at the civil commitment statute that didn't produce. Oftentimes work groups, we have to have them produce something for us to take a look at the legislature in order for us to go forward. So it's a much more complicated issue than simply changing the statute. That being said, I do think that we need to continue to look at that statute and make sure that we have the best civil commitment statute that is addressing the needs that we have right now. Things have changed. When I was in 1995, when I became a district attorney, there was this new thing called meth that was coming our way. We have this new meth now, which I think Dr. Keepers can probably really attest to, which is almost instantly changing people's brain chemistry, and it makes them much more violent. So we do have to be rethinking the way we do things. The thing that I am concerned about with regard to the civil commitments is we have already extended all of our capacity. When I got here in 21, we opened up every single bed that was left at the state hospital. So we opened up every single ward. We are struggling with the Mink decision, which I think Dr. Keepers talked about, with the fact that that hospital has now become a forensic hospital, and our civil commits are sitting in emergency rooms and in other hospital settings. I don't know where they would go. And I just put that out as something that we need to think about when we talk about whether or not we should change the statute. We also have to make the promise that we're going to have services available to them. So
Agreed.
We have to think through the systemic impacts of changing the law. That's not to say we shouldn't do it, but I think that that's sort of step two of the discussion.
All right. President Peterson, quick question for you. And I would say that I understand Metro's point of view is they're not in the behavioral health, and I know you're running for Congress. And so we don't have Senator Wyden, who wanted to be here, and I don't want to provide a proxy for you for obvious reasons, but what is your thought? And then we'll move on to Commissioner Myron, your thoughts, as well as locally and federally we might be able to do. Are we ready for this?
For the civil commitment portion of this conversation?
Yes.
I would say that what I'm hearing is that, again, just like Measure 110, we do not have a perfect system, and there needs to be a well thought out systemic conversation. And honestly, this is what I hear just as the engineer in me, not the lawyer, not the ER. Doctor. You guys are amazing in this space, and I defer to your expertise, but as the engineer, we in Oregon have been really good putting Band-Aids on and Band-Aids on and Band-Aids on and Band-Aids on, but we haven't gone back to what are the core systemic problem and where do we get the most bang for our buck, and be able to have that really mapped out. When we had the conversation here at Metro that Representative Blumenauer put together on mental health, it became clear that everybody knew what a barrier was or a problem was within their silo, but there wasn't they were having a hard time having a conversation about going all the way back to what are the systemic problems that need to actually be the big, difficult conversations like this that need to be dealt with. So I would just say Oregon needs to really learn how to do systems mapping and have conversations where it's not just about my problem or in yesterday's filing of a form or that I didn't get my money. It has to go all the way back. We need to be more proactive and less reactive. So that's what I would just say in terms of this entire conversation that we're having from stem to stern. And Metro's role, it has been with the SHS money to at least provide in the Tri-County planning body the space where we can have those conversations. We're getting to those conversations. We have the ability to have those conversations, but it's still only a piece of the entire puzzle. And so I would just say on behalf of I think all of us elected officials, it would be very helpful to find the space to sit down with experts and this is almost a convention center size thing to kind of map out, right? It is not just having 5 people in a room, and it's not having 10 people in a room. It's a lot of people that need to be able to say, that's not how the system really works. That may be what you think it does, but that's not how it really works. It's to Christy's point, here are all the things that you said were supposed to happen, but for all these reasons they didn't. And how do we actually realize that? So I guess what I would say is if we were to be more proactive, we would be doing proactive and reactive at the same time. And as people, it's really hard for us to be in both spaces. Governor Kizzaber used to say it's like being on a ropes course. In order to get change, you have to actually let go of the rope you're on to get to the new rope. So for that moment in time, you have to be able to do both. And if we were to be more proactive, right, we wouldn't want people to be in these positions in the first place. And so how to, back to Senator Lieber's conversation about our educational system, our ability to have enough housing, market rate and affordable and low income, the continuum of housing, and have it living wages. I don't want to take up too much more space, but I haven't, this is really my soapbox for the day, is that we, in order to afford an apartment anywhere in this entire region, you need to make $26 an hour or more anywhere in this region. I'm talking Forest Grove to Wilsonville to Gresham. It's not just a city of Portland issue. And until we actually have people who can afford to live in this region and not be one traumatic experience away from being homeless or feeling like I can't handle my life and I'm going to need to numb myself. Yeah. We need to be able to do both these things and be proactive as well as reactive. So what do we need on the federal level, state level, local level? We need to start actually engaging in private-public partnerships for both jobs as well as housing. And I could go on and on for another half hour on both those things, but we'll just leave it at that.
Right. Thank you so much. We have a moment left. Rep. Dexter, Mayor Wheeler, Commissioner Myron, would you like to take this home for us?
I would love to speak because I've been involved in this issue for a couple of decades now, at least a decade working on the issue at the state level with the task forces and expert roundtables and gap analyses and discussions that have been happening where all of the people in the room have had the conversations, and we are so beyond having another meeting about this. We need urgent action. And this conversation has been had, and I think just even the conversation here illustrates where the disconnect exists between the experts facing this every day. As an ER doctor, I've seen thousands of people who I know are not safe, that I cannot hold against their will because they don't meet the level of civil commitment, imminent harm to themselves or others at risk of that. Portland street medicine, I go out and volunteer and see people living on the streets who can't care for themselves, don't know who they are, where they are, if they're naked, if they're hot, cold. Working in this field for decades, I know people who don't have capacity to make the most basic medical decisions, and we'd step in for them for that. We do that as physicians for everything except serious mental illness and addictions. We need to be making this decision. It's a statutory decision at the state level. We need a medical model for it rather than sort of looking at it from the public safety judicial standpoint. And we need to move forward compassionately, thoughtfully, and effectively now.
And thank you, Commissioner Myron. Mr. Mayor or Representative Dexter, would you like to say something?
I'll go after Representative Dexter.
Okay, thank you, sir.
Great. I'll be really brief. I think, are we ready for civil commitment to lead to court-ordered treatment? I 100% agree that the threshold in Oregon is too high. I can attest that we do exactly what Commissioner Myron just said. We don't feel comfortable holding people because we cannot say they are at imminent risk of harming themselves or others. That is too high of a standard, and we are failing our community by not changing this statute. That all being said, I want to underline what Senator Lieber said, and precisely why I didn't support a bill for this going forward in the past, is if we civilly commit someone, it cannot be jail and it cannot be the hospital that they go to after that commitment happens. We don't have a place for them to go. And until we have a place for them to go that is safe, as safely staffed, that we don't eliminate our ability to sustainably operate that place because we can't keep staff in there, we have to be thoughtful about it. So yes, we do need to do this, and it can't happen immediately because there is nowhere for people to go right now.
Thank you, Representative.
First of all, I want to thank you all for hosting us and bringing us all together, and I really appreciate the panelists. This was, I think, a really thoughtful discussion. I'll end on two notes. Number one, this is a tough issue in Oregon because historically there's been an unwillingness by elected leaders in particular, but not exclusively, to get in the middle of this. We need to get in the middle of this. The second comment I would make is we need not just to talk about systems, we need to talk about the culture here. And we need to talk about the nature of what is compassion. I have increasingly come to the conclusion that it is compassionate to take the lead and put people in a situation where they can gain access to whatever services they need to get help. And leaving them to die in squalor on our streets is the opposite of compassion. It is an abdication of responsibility as leaders, as people who profess to care about vulnerable populations. We need to help people. And I strongly believe it's too easy to avoid the difficult questions like the question of involuntary commitment. And by the way, I strongly support making it easier for us to get people off the streets who obviously need help that they themselves either don't acknowledge, can't acknowledge, or just don't have the ability to access. We need to give people that opportunity. At a minimum, put them in a location where they can get back to a cognitive place where they can decide, understanding what's actually at stake. But this constant refrain that people have a constitutional right to die on our streets is unacceptable to me. And I do not think it is compassionate. And I've looked hard into my own heart, and that is the conclusion I have come to, that a compassionate community would get in the middle of this and would do more to help people who actually need that help. And I agree with those who say that the civil commitment standard in this state, while I understand where it came from, and historically there is an ugly past here to our institutionalization and what it led to for many people unjustly in our state, but now we need to accept the reality and we need to course correct to address the obvious unfolding crisis on our streets. And so, for however much time I have left, I think it's 14 and a half months and 3 days and 7 hours, I'm going to continue to advocate for what I think is actually the compassionate response. Put people in a situation where they can get the help they need to move on with the rest of their lives. Quick story. Years ago, when I was chair of Multnomah County, we had a hearing on this very topic, as Commissioner Myron mentioned. This is not a new subject. And there was this woman who came into the hearing who had just locked her own son in the garage to protect himself and to protect others. And she was terrified that he was in a psychotic state where if he did not get help, he would commit some serious crime and there would be no way for her to help her son. And that, to me, perfectly illustrates the nature of compassion as I'm describing it. We need to give people options, and it's up to us. And it's up to all of us at all levels of government to work with OHA, to work with public health agencies, to work with the hospitals and the CCOs and private sector organizations, nonprofits, philanthropies, the faith community. All of these folks have a stake in this, and we got to work together. And I agree with Sharon. We need to stop talking about this. I'm tired of the talk. I'm just growing old on the talk. We know what we need to do. Let's do it. We need a plan. We need to know who's in charge of what. We need to know what they're going to do and how to fund it. That's what we need. And that's what I hoped would come out of that meeting of 42 people who are experts on this subject. Most of us on this call were in that meeting. And at the end of it, hilariously, I got a letter saying I needed to do more to rebuild the mental health system in the state of Oregon. And I'm all for it. If I have the authority, if I have funding, if I have access to the Medicaid dollars, if I get the SHS dollars, and I get the federal authority to do what I would need to do to rebuild that system, but I don't have it. So I need to partner with everybody else on this call. And I cannot underscore, again, going all the way back to Christy, that what we do and how we respond to this is going to lead to what I believe is a compassionate approach. So thanks. I went on longer than I wanted, but
Mr. Mayor,
I appreciate
I appreciate that, Mr. Mayor, and I appreciate all of those who stayed on. And it's just after 5. But what I do want to kind of just bring to a close is, the members brought up the need to address those that are hurting on the street. Civil commitment was one of those critical things. And what we just discovered in this meeting was that not only the members had kind of plugged in, but every policymaker just said we need change. And so we found that gap, or we found a gap of many gaps. I hope that we have that courage and opportunity to really start filling that one, to create that continuum together. So Stan, I'm going to bring you in, and just why don't you take us home, Stan? But I just want to just say how grateful I am that all 5 of you were here. It really is a multi-jurisdictional opportunity. These panels are really important for each other to hear one another out. Thank you so much. Stan?
Oh, thanks, Keith. Many thanks to our participants. Mayor, it's a hard act to follow because you said a lot of the things that I was going to say in my conclusion, but I will just pile on. As I said in my opening remarks, we don't want to leave this forum today after such a substantive conversation and then see that nothing changes. Today, we heard a compelling description of our behavioral health crisis and many ideas from our panelists for solutions. It will take political will, proper allocation of resources, innovative thinking, and community advocacy to remove our state from the sad distinction of being close to last in the nation to address mental health. We need action, and we need it now. Let's all leave here today with a commitment that our community and elected leaders will move forward together to fix this crisis. We organize this forum to focus on finding solutions and we will continue to advocate and push for true results. Many thanks to our panelists and the nearly 400 attendees who joined us today. Keith, did you want to have one last remark?
I think that's probably one remark too many. I had plenty of time to talk. Thank you so much, Stan. And thank you
Okay.
all very much. It's been my great pleasure.
Our pleasure. Thank you, everyone.